Okay, I think we're going to get started. I'd like to thank everyone for joining us. This is the first seminar of the Western Center for Agricultural Health and Safety seminar series. We're really happy to have you here. This is our first Zoom seminar, and we're thrilled to have some great speakers talking today. Before we get to introducing them, I'd like to go over a few housekeeping items. First, I'd like to note that the seminar is being recorded. Let's see, there we go. And also all participants are muted. During the presentation, if you have questions, either for those of us who are moderating the presentation or for the speakers, please use the chat function to pose your questions. At the end of the presentation, we will have time for the presenters to answer a few questions. Also, this presentation is going to have both an English and a Spanish component. Interpretation services are available. At the bottom of your screen, you'll note that you can select either the English or Spanish channel. If you speak only English, please select English and you will hear the interpretation of the Spanish presentation. If you speak both languages, you can leave the interpretation off. Do not select English or Spanish, and you will be able to hear both presenters speak themselves. And we'll go over that again as we get to that point in the presentation. We anticipate it going smoothly, but if there are any problems, we'll try to help everybody sort them out. And I think we can move on now, and I'd like to introduce Ildi, Carlisle-Cummins, and Oralia, Maceda. They are going to present today on the COVID-19 Farmworker Study. This was a really great rapid response study of California farm workers that involved community-based organizations, researchers, and others across the region. So Ildi, I'm going to turn it over to you and Oralia, and you can introduce yourselves and the project.
Hi, thank you, Heather. Welcome, everyone. Let me pull up my slides and I will do our intro. Sorry, go. There, hopefully everyone can see that. Yeah, thank you again, Heather, and all of the team at the UC Davis Western Center for Ag Health and Safety that's made it possible for us to present to you all today, and that has really been a project partner in this study since the very conception of the study back in March. So we're glad to be here and glad to be with you in this work. I'm Ildi Carlisle-Cummins. I am the Executive Director of the California Institute for Rural Studies, CIRS. We've been around for the last 43 or so years in California, studying exactly these types of issues and working hand in hand with communities to make sure that data and information about life in rural communities creates the kind of communities that folks living in rural California want to see. So data for change, research for action has been our bailiwick for the last 4 decades. And I'm glad to be here presenting on our latest work on COVID-19 in the farm worker community. And I'm honored to be here today in partnership with one of the key people that helped to achieve this study, Oralia Maceda. Oralia, do you want to introduce yourself as well?
Gracias, Ildi.
Thank you, Ildi.
Mi nombre es Oralia Maceda.
My name is Oralia Maceda.
Y yo soy directora de programa.
And I am a program director.
Del Centro Binacional para el Desarrollo Indígena.
Centro Binacional.
Oaxaqueño.
Centro Virginal del Oaxaqueño.
Okay, were you done, Oralia, speaking? I wasn't sure if there was a pause in the translation. Is that it?
No,
okay.
Está bien, siga adelante y ya después continúo.
No, that's it. Go ahead and continue, and then we
Okay,
can go ahead
okay.
and keep going.
Wonderful. Okay, thank you. Yeah, so we're here today, Oralia and I, together to present some of the findings from the COVID-19 Farmworker Study. As some of you on the webinar today might know, there are about 800,000 farm workers in California, and they work at seasonal jobs. They are the folks that are at the very base of our food system. They're the ones that are quite literally picking and planting and packing the produce that feeds all of our families. But as many of you probably know, because of the seasonality of their work, rarely full-time year-round, they make around $18,000 a year on average. And we can estimate that about 90% of California farm workers currently were born in Mexico, and roughly, estimates are hard to count exactly, but roughly 60% or so are unauthorized to work in the United States. So we know that while these folks are working hard to feed all of us, providing the food for all of our families, and that a range of essential workers have been on the front lines here doing critical jobs that support the rest of us, make life easy, make life possible. The farm workers who are often outside of social safety nets for the reasons I just described, really lack critical protections in this time of COVID-19, and they're much more vulnerable to some of the economic and the health and the social effects of the current pandemic. So this is something that CIRS has known for a long time, the longstanding vulnerability, the invisibility often of farm workers in California. And so in March, when the shelter-in-place orders came down in California, we put out a query to a collection of community-based organizations and researchers to ask who is going to be tracking the effects of COVID-19 on farm workers specifically. And a big group of folks, a deep bench of researchers and policy advocates and farm worker serving organizations came together really quickly in the middle of March to launch this two-phase COVID-19 farm worker study. And if you haven't visited the website for the study yet, I encourage you to. It's there on your screen, just COVID-19farmworkerstudy.org. You can see the long list of partners that have made this project possible. The folks that we're going to mention specifically today are the community-based organizations that are at the heart of the study, made it possible for us to do a farm worker study in the midst of a pandemic because of their long years of community organizing and building trusted networks. But there are many, many folks that were working in various support roles and study design roles and research roles behind the scenes, and they're all listed there on that on the website. You can also find our data briefs on the website as well. So if you want to have in front of you some of our findings, you can look for them there. So we are going to be talking, Oralia and I, today about the results from the first phase of the California study. The COVID-19 Farmworker Study is actually a 3-state effort. We have colleagues in Oregon and Washington that are currently in the field doing surveys with farm workers. Their season starts a bit later. Many farm workers migrate from California north following the crops. So their survey sort of mimicked that seasonal flow. Oregon just released preliminary results. Washington will be done with their first phase survey in the coming weeks, and we'll begin to be able to have tri-state data. But for now, we're going to share with you some of the data from California specifically. And as you can see in our graphic here of the way that the project is organized, by mid-March, we had this big group of researchers and community-based orgs mobilized together, thinking through a study design. By May, we were in the field with a survey, 70-question survey that we had piloted and trained interviewers to conduct. And then our 6 community organizations, so in California, that's the organization Oralia represents, the Centro Binacional Oaxaqueño, a small organization called Alianza Ecologista in Porterville, the Central California Environmental Justice Network, also located in the Valley, Líderes Campesinas, Comité Cívico del Valle in Imperial County, and one other organization in San Diego, the Farm Worker Care Coalition. So that group of 6 folks came together, and from May to July, we're conducting these surveys throughout their networks. We eventually collected 915 surveys, so had conversations with farm workers that lasted from 20 to 45 minutes about how COVID was affecting their lives in the short term, sort of the immediate impacts of the survey. I mean, of the pandemic were collected in the survey. So we asked them questions about household conditions, about workplace conditions and changes, transport to and from work. We asked them about how they were accessing healthcare and if they had a plan for isolating at home if someone got sick from COVID, those types of things. But we always knew as a team collectively, and I should say CIRS is in a facilitation role here. So there was a lot of brain work and a lot of people contributing to this effort. I've been doing choreography really on the study, but it was a team think that made this thing happen. So we always knew as a team that we needed 2 phases here. One, to do this rapid response information gathering about immediate impacts on farm workers of the pandemic. And the second one, which we launched in August and is ongoing, we expect to wrap it up by the middle of this month, which is qualitative, longer, in-depth qualitative interviews with a smaller subset of the folks that were surveyed. And in that qualitative survey, which is being led by a couple of anthropologists, Dr. Deborah Saxton and Dr. Bonnie Bade, along with a research team from the Central Valley. The qualitative, longer, in-depth interviews are asking folks about social impacts of COVID-19, about more questions about economic impacts, longer-term impacts of this COVID shutdown on farm workers, and about mental health and anxiety and stress levels, which we know are going to have a longer term impact, maybe even than some of the impacts of the virus itself. So we're now in that phase. And the tools for action that we expect to create are listed there in the data for action box. The preliminary data brief and the survey methods brief that describes how we did this and the demographics of the folks that we talked to are available on the website that I mentioned earlier. So I'm going to keep going. Here you can see the map of the surveys that were collected. So as I mentioned, by July 21st specifically, we had done 915 surveys. And again, that's really thanks to the trusted networks of the community-based orgs that were at the heart of this. You can see that we allocated surveys, we distributed the surveys across the state of California, and those, the way we distributed them was based on the calculations of ag labor demand in typical summer months. So we really heavily sampled from folks in the Central Valley, and then, you know, our second most heavily sampled region was on the Central Coast. We've talked to folks in the South Coast counties and the desert counties and a few folks on the North Coast. We talked to people, workers from across a few different kinds of employer types. So that was really important in the design. We knew we wanted to talk to people working directly for growers themselves, people employed by packing houses, and people employed by farm labor contractors. And we did find some important differences in terms of working conditions across those kinds of employer types. And we also, you know, we had some target demographics that we wanted to meet so that we would be able to say that we talked to, you know, the right proportions of men and women, younger workers, older workers, recently arrived folks in the US versus folks that had been here longer, et cetera. So we developed some kind of demographic goals for that. But ended up, you know, snowballing through, of course, our trusted networks of contacts that the community-based orgs had. I'll get to that in just a second. Let me go to my next slide. Okay, So we knew that this was going to be a tough research moment. We knew it was really important to bring farm worker voices into the conversation about what the public response should be to COVID-19. So it felt critical to hear from workers themselves about their experiences and share that as widely as we could with as many different kinds of people as are making decisions and would want to hear it right now. But we knew we were going to have to do our survey by phone, which is not a research method that we typically use. CIRS always does face-to-face interviews, as do a lot of our partners, the easiest way to reach workers. But we knew we were going to need to do a telephone survey. And we knew that it was a really challenging moment. So we were able to do that, to create some data, some information right now, because of this partnership between these frontline farm worker serving organizations. Like I said, we snowball sampled among their existing networks, folks that had built trust and connections with workers over time, you know, people with contact lists of farm workers where we knew people would actually pick up the phone and answer. And we partnered those folks with, you know, experienced researchers who helped in the design of the survey. They helped to train some of the staff of these farm worker serving organizations. And then they worked sort of in simultaneously on the back end of the project, cleaning data as it was collected, as it came in. So those are the two reasons why we were able to pull this off in this crazy research moment. And then one thing that was critical in the design of the study, and that Rick Mines, who was one of the main powerhouses behind survey design, brought to the project, was to really couple comment boxes, qualitative answer, the ability to collect qualitative answers to our quantitative questions right alongside the quantitative. So this is actually a Rick Mines slide, but he gives an example here. Question 14, we asked this seemingly straightforward question, or you could think of it as a straightforward question. Have there been changes in the number of conditions or of bathrooms, number and conditions of bathrooms or hand washing stations at work? The response you might think might be yes, no, or other, but there was a whole range of sort of nuance that people reported on connected to that question. So sometimes an answer that an interviewer would mark, yes, there were changes, and that the comment box would explain that there were, you know, that those changes had happened prior to COVID-19, or vice versa. And an interviewer would respond, no changes, and then the person would go on to say, well, they actually added a bathroom over here, or things like that. So the combination of comment boxes that allowed us to get farm workers' response down in their words with quantitative questions allowed our data team behind the scene to make corrections as we were getting the data in. And that was really important for the speed of the project, and also for the kind of collaboration between farm worker serving orgs, many of whom are not trained professional interviewers, and researchers who have done this 1,001 times. And there was a way to sort of collaborate and clarify as we went in a team. So I've listed a few ways why this data we feel is sound. You know, we had this deep bench of researchers. We had community-based organizations at the heart of this study that made it possible to pull off right now. But we also found that even though our selection process wasn't random, an analysis of what we have in terms of the demographics of the folks that we talked to finds that it does really mirror what we know about California farm workers. So we successfully targeted surveys, as I mentioned, from across California farm areas, and then we looked at the data from the National Ag Workers Survey, the NAWS, on age, on gender, on crop that folks are working in, on age of arrival, years in the U.S., task, etc. And we have a pretty good reflectivity. We have a pretty good sample that mirrors that what we expect, you know, the demographics of a sample of California farm workers would look like. And importantly, in large part due to Oralia's organization and their dedication to serving Indigenous farm workers, we have a large sample of Indigenous farm workers within our study. In fact, I think it's 36% of workers are Indigenous workers in the study. So, so we can look at particular demographics, pull them out, and produce data that's relevant to those populations specifically, which we're really excited about. Here's an example of the kinds of analysis we're engaging in now. So what you're hearing from us today is an analysis on some of our preliminary data. We're currently having shared preliminary insights, which it felt like important to get out and get into the policy conversation in a timely way. We felt like it was important to tell folks about the methods and the demographics of the study, so those two things could be paired together. And now what we're doing is combining, you know, doing some combined analysis on the demographics with some of the reported changes on how COVID-19 has impacted workers. So this is an example of how we can do that, the kinds of analysis we're doing now. This is mask wearing by age group, you know, and here's an example of how, you know, we can kind of identify, begin to break out, you know, who within the farm worker community is being impacted by the lack of masks, or who, you know, which workers are more likely to report always wearing a mask. And in this case, we found that younger workers are least likely to report always wearing a mask. So that's just an example of the kind of analysis we're doing now. So we have just here a summary of how we pulled this project off, right? We combined farm worker frontline groups with experienced survey researchers. We got a selection that reflects both the geographic distribution and demographic traits that we would expect for a farm worker survey in California. And we collected data on COVID-19 impacts on the behaviors and attitudes of farm workers. And then we're creating tools for analysis by comparing those changed behaviors with the demographics that we have. And we're doing all of this in the spirit of research for action, in the spirit of creating change that CRS always does its study in. And so we've created, you know, one-pagers with recommendations, as well as policy, or as well as data briefs that make targeted recommendations about how we might be improving the situation for essential frontline workers like farm workers in this moment. And whenever I've been talking about this study, I've been saying the data, which you're about to hear some information on from Oralia. Oralia is going to share some of the findings of the study. The data is one thing, it's a powerful resource. We're glad to have had this team to be able to collect it. But the methods here are also something to point to. They also, you know, the fact that we could never have pulled this off without this community-based orgs at the heart of the project really says something about the way we can be reaching farm workers right now with any kind of support, whether it's mask provision, whether it's you know, state agencies trying to provide direct cash aid to workers, whatever kind of support it is that we want to be offering our farm worker communities also needs to rely on some of these trusted networks that have been built by community-based orgs. And we know that CBOs like the Centro Binacional Oaxaqueño from the beginning of this pandemic have really stepped in to fill gaps in services, whether it's the state or the county, local governments, not able to reach farm workers, not with developed enough networks within farm worker communities themselves. And so we really hope that the study shines a light on the ways to reach farm workers and pushes back on this idea that's often referenced in research about, you know, who's a hard to reach community versus a community that might be more on the grid, easier to reach. And clearly for the community-based orgs that we're in partnership here with, farm workers aren't hard to reach. They are their neighbors and their friends and their relatives. So so reaching workers in this moment and and ongoing has to be done hand in hand with the folks that those workers trust. So I think with that, I think my next slide is for Oralia. So I'll stop there and hand it over to Oralia, and then I'll come back at the end for a quick review of our recommendations. And then hopefully we'll have a good conversation today. We're eager to hear your questions. Thank you.
Gracias, Ildi.
Thank you, Ildi.
Voy a continuar con la presentación.
I'm going to go ahead and continue with the conversation.
Algo que queremos compartir o que
something that we want to share
es lo de el acceso a la salud.
Is the access to healthcare.
O la cobertura que se necesita en nuestra comunidad para
or the coverage that is needed in our community.
Sin importar el estatus migratorio de las personas.
Without thinking about what their immigration status is.
Durante estas entrevistas que tuvimos con trabajadores del campo,
during these interviews that we had with these farm workers, let me just stop there. Oralia, ¿puede escuchar mi traducción?
Sí.
Quítese del canal para que de esa manera usted pueda nomás estar hablando y yo puedo interpretar sin que usted me escuche.
Okay. Yo creo que ahí está.
¿Me puede escuchar?
Entonces lo que nosotros encontramos.
And so what we found is that 50% of the people that we spoke to commented about the difficulty of having health insurance, that they don't have health insurance, that they don't have these sick days. And because of this, a lot of them don't have this opportunity to receive that health care during these times of the pandemic that we're facing. They also expressed the fear of being able to receive these services because of their immigration status and also because of this publicity that exists. So these are things that we found during our study, and how these farm workers are having right now these difficulties with all of this. Ildi, will somebody go ahead and help me get to the next slide? Okay, thank you. In this part, I'm going to speak a little bit about this indigenous community. As I had mentioned, as a Centro Binacional, we work with communities that are indigenous, and a good majority of us come from Mexico. We're Mexicans, but a lot of these healthcare providers assume that we're coming from Mexico because we speak Spanish, right? They think we speak Spanish, but it's not like that because there's other languages that are spoken in Mexico. In particular, right now we're working with communities that speak Mixteco, Zapoteco, Clicli, or Tapanico. And these are some of the languages that they speak in Mexico. I had already mentioned earlier that us as Centro Binacional, we did about the 33% of the surveys, 36% or 16% of these 36% of the people that we interviewed were done in indigenous languages. And so we realized that the community that speaks Spanish has some barriers, but these barriers are still doubled for this indigenous community. And so that also, this language barrier is one of the factors in why these indigenous communities aren't receiving the information necessary about what is COVID, the ways that they can protect themselves, and also the changes that are occurring right now about the laws that are changing, the benefits that they have as farm workers. This information that there is, it's either in English or in Spanish, but it's not in indigenous languages. And so part of what we try to do as the Centro Binacional, what we've been trying to do is we've been doing audios or videos with information in these indigenous languages. And that is also something that we found in this study, that the language is also one of the barriers on why they're not receiving these services. Next slide, please. So this next part about the economic effect of it. Another one of the questions that we asked was about the economic question about these farm workers. And 51% that responded to this survey have reported that their income has been less in their households, and there's various reasons for it. One is because, like all of you know, right, schools are closed during this moment, the childcare places as well, and so these farm workers didn't have access, or they didn't have a place to leave their kids in school or in these childcare places. A lot of them had to stop working in order to take care of their kids. This had an impact, a big economic impact, in paying rent, food, all these other expenses that are needed in the household. And this is something that has impacted our community a lot. And more than anything, our community that doesn't have a legal immigration status right now, because they don't have access to unemployment, sick days, or any other support. And so this is one of the reasons why they've seen themselves economically affected. Another one of those things also that has happened is that in these fields, there's a lot of these workers, and so these bosses haven't increased their pay. Contrary to that, the work is finishing very quickly during these seasons, and the reason is because a lot of people that used to work in restaurants or in hotels, they lost their jobs. People that were also dedicated to the commerce businesses, they also had to come and work into the fields. And this also increased the difficulties for these farm workers. And so the season went a lot faster. And this made the workers have less income into their households. And this is another one of the things that we found during these interviews that we held. Next slide, please. Here we can also find in this part some of the things that these farm workers have commented to us about what's happening in their workplaces and the conditions that they're facing. And what they've commented to us is that not all of them have been following these good practices. Not all of these workers have been following the social distancing of these 6 feet that is recommended to go ahead and avoid this getting COVID. Not all of the employees have also been following these recommendations that have been emitted so that the getting COVID is decreased, the probability of getting it is less. And so these farm workers shared with us that it's worrisome that the conditions in which they are working in, not all of them, like I said, have been implementing the correct practices. They're not giving them the protection that they have to have as workers. We also spoke to them about if they've received information about how to protect themselves in these workplaces. We heard that it hasn't been happening in these workplaces, and in particular also in indigenous languages. This has not happened either. So some have commented that yes, they've received a pamphlet or something around the lines, but even though people speak Spanish, they said that there is some words that they're not able to comprehend in Spanish. And so this is the condition in which these farm workers are operating under. And that is also why during this time we would ask how they've been affected by the virus. When we started, we heard that there wasn't a lot of people that were infected. They know that they knew some people that had been infected, but then at the end of these surveys, it's when we found more people were being infected with COVID, or that they've been in contact with somebody that has been infected. Next slide.
Otro también que
the other thing that we spoke to with these farm workers, and what they shared with us, is that they have been taking precautions about how to protect themselves, and the fear that they have to bring that sickness home to their families. There's some farm workers that live with their kids or live with their parents that are they're older in age, and this has also helped. Well, this has made it so that they have more precaution when they get home, so that they can avoid infecting their families or infecting their kids, infecting their parents who are older in age. And they also shared that they are trying to protect themselves in their homes and when they go to the store and all of that. So those are the ways in which they are avoiding that the virus keeps growing in our communities. More than anything, the fear that their families will get infected, because, as I mentioned before, they're scared because of this lack of lack of access to medical services. Next slide.
Aquí Ildi va a continuar.
And here, Ildi will go ahead and continue with this part of the presentation.
Creo que ya regresó.
I think so.
Yep, here I am. Thank you, Oralia. Appreciate your sharing of the data and some of the things that you heard, or Centro Binacional heard in the survey collection process. So I'll just highlight quickly, as I mentioned, you know, we did this research project for action, and the idea has been to produce, to make some recommendations, to feed some of this information into the policy conversations that are going on, and the community level change that is happening in response to COVID-19. And here's a quick summary of the kinds of things that we're recommending based on this survey, which I didn't mention earlier. Because we were able to mobilize quickly in the way that we do, we have some of the only data available in the nation now on COVID-19's impacts of farm workers over the summer months and even going into the fall here. So that data points us in particular directions, and those are listed here. We think it's really important that we're monitoring health within farm worker communities and enforcing laws. And that includes letting people know when infections and outbreaks happen. You know, for many months, the only county in California that was reliably reporting COVID-19 infection rate by occupation and by industry, so we could understand that it was impacting the farm worker community. The only county doing that for many months was Monterey County. And actually at the time of the release of some of our first data, CIRS also produced a report written by Dr. Don Villarejo that showed that, you know, farm workers in Monterey County were 3 times as likely to be infected by COVID as workers in any other industry. And there was a lot of press at that moment on that fact. But, you know, the point of that was not to say that farm workers in Monterey County have it worse than farm workers or agricultural workers in other parts of the state. We don't believe that to be true. It was probably the case that, and some of the later data that has now come out in the Central Valley and other regions show that farm worker communities themselves across all of our counties have experienced surges in COVID-19 and have sometimes been hotspots for the pandemic. We just haven't had the kind of data tracking and transparency that we would need to understand that. With the passage of AB 685, recently, the California state government has begun to mandate new levels of data collection and transparency. But we encourage further development in that direction. Getting a handle on when outbreaks are happening and where is really important for all of us. And then, you know, we've hammered on this a lot in this presentation, but it really is at the heart of this, mobilizing community partnerships. So including community-based organizations in disaster planning and responding to needs is really critical. And, you know, there are still current needs around mask distribution, and particularly now with wildfire smoke, of course, compounding the vulnerability of workers. N95 specific mask distribution, still a major need for that in spite of several programs and pushes from the state and others to distribute masks. We found, as Oralia mentioned, that mask provision was low in the summertime, and we hear from our networks that it still is lower than we'd want it. And now as as COVID-19 and the pandemic stretches on beyond the 6-month mark, thinking about how we're balancing physical health priorities around COVID-19 prevention, which is so critical, and of course important to prevent death and pandemic spread, with some of the mental health issues that are coming up around fatigue and stress and exhaustion, particularly related to school closures and the lack of childcare, and how families are balancing now what in a 2-income household was a tough road to balance bills and expenses, and now with one person having to stay home with kids because of lack of childcare, the additional sort of pressure box that puts families on. So thinking about the balance of the long-term effects of COVID shutdown with COVID prevention itself. And then really thinking about some of the things that Oralia and CBDIO have been really good on. How do we communicate, not just in English and Spanish, but with the variety of farm workers that speak Indigenous languages? And how do we make sure that materials are arriving, or messages are arriving to farm worker communities from trusted sources and in languages and formats that they can hear and understand, and that really reach them? That, you know, thinking about being paying a lot of attention to the ways that we're communicating, making sure it's linguistically appropriate and that folks are really experiencing language justice is really important. And then, you know, linking to and providing care across a range of issues. So really thinking about some of the social determinants of health, thinking about how compounded structural problems have impacted farm worker vulnerability to COVID-19. You know, overcrowded housing is you know, definitely an issue for isolating when COVID-19 reaches a household. Healthcare access, Oralia mentioned some of our findings around barriers to healthcare because of fear of deportation, or, you know, fear of interaction with a healthcare system that has typically not served farm workers very well, if at all. Thinking about how food insecurity and income pressures impact health decisions, and childcare, as I mentioned. All of these things are critical to responding in a real way to COVID-19, and in the way that, you know, the workers who are feeding us all really deserve. So I'll end there and say that next steps for the COVID-19 Farmworker Study, as I mentioned at the beginning, are conducting the second phase, these in-depth interviews with workers. We hope to report out on the results of that second phase by the end of the year. And I think combined with the quantitative data that we have from the survey that you've gotten a taste of here, and those qualitative stories and in-depth conversations, we'll be able to continue to make sure that farm worker voice really is represented in the public conversation about how we address the pandemic. And I look forward to answering questions and having a conversation with you all here now. Thank you.
Wonderful. Thank you so much, Ildi and Oralia. It was really great to hear an overview of this study. We do have several questions, and so I'm going to do my best to point them in the right direction, but please obviously pass the question as appropriate. I'm going to go back to some of the topics from the beginning of the presentation. Specifically, we had a question about participant recruitment. And Ildi, I'll direct this to you. You mentioned the study sample target, that you had study sample targets, and that you used some snowball sampling as an approach. Can you discuss any impact this may have had on the study results? For example, because you partnered with CBOs instead of employer organizations and employers generally? Mm-hmm.
Sure, yeah. Clearly, our sample is not random. We're very upfront about that. This is not a random sample the way that the National Ag Workers Survey is. And we chose a snowball sample method with community partners because we knew that we hoped that it could reach workers in this very precarious moment. So we knew we weren't going to get a random sample. We knew that a sample snowballing through networks had a hope of being effective and providing some kind of data now. And so that's why we leaned into that. We leaned into that method. Some of the community partners that we partnered with were already in the field calling down their networked lists in order to find sort of testimonial, anecdotal evidence about what was happening to COVID-19. So this matched an existing kind of community effort, we paired that snowball sampling technique with some careful thought about which regions we were going to talk to people in and what we wanted some of our target demographics to look like. And then the research team met weekly with the folks, the community-based organizations that were leading surveying, to say, okay, hey, it looks like we need to interview more young men who are recently arrived. Can you try and find folks within your network that might meet that target demographic? So it's not a perfect random sample method, but we did try to sort of have it reflect demographically what we know about the farm worker population. And in the end, I think we were pretty successful with that. We missed the mark in a few categories. We did talk to more women than men, as we know in the farm worker population. And there were a few other minor categories that in ways that the COFS data does not reflect the farm worker population overall. But we did pretty well, I think, for the times, and using a method that we knew we could rely on in a very precarious moment.
Thank you.
Mm-hmm.
Okay, Oralia, I'm going to direct the next question to you. So surveys were collected in May and June. Have you noticed changes in the implementation of safety practices and the provision of masks as more attention and resources have been given to the issue?
Ahorita sí hemos visto.
Right now, yes, we have seen an increase in the distribution of masks, but it's been interesting that these resources have gotten to the counties or the agricultural departments, and as organizations that are community-based, we've collaborated and we've asked that they share with us these masks. And a lot of us as organizations that are community-based, for example, I'm going to talk about Centro Binacional. We've been going to these fields, speaking with the workers about why they should protect themselves, and we've been distributing these masks from here, from the county of Fresno. We've received about 7,000 masks that the Department of Agriculture has given to us, and we've been distributing them ourselves. This hasn't happened in all the counties. In other counties, if they have them, they've been giving it to the agricultural workers. That's what they've been telling us. But when we go to these fields, we don't see that the workers themselves have these masks. So yes, there is, but us as organizations based on the community, we've been taking them. But the fact that they've been just providing them, we haven't really been seeing this happening.
Oralia, I'm curious if you have a recommendation for how that mask distribution could be run differently to increase the effectiveness of getting them to workers.
Sí, yo pienso.
Yes, well, I believe that there is organizations that we've been working directly with the community, and in a certain way, the community already knows us. Yes, the Department of Agriculture or the state or the department that's in charge of giving these materials could collaborate with our organizations based on communities. We would be very happy giving these materials to the farm workers, to the community itself. And I believe that that would be a big effort that we could do together, to collaborate together, to make sure that these materials are getting to the hands of these workers.
Great, thank you. Okay, I think that if we're brief, we can do maybe 2 more questions. We've gotten many, many questions. Ildi, can you describe some of the differences that you observed in the data between employer type?
Yeah, sure. So one of the things that we found, and this might not be surprising to folks here, but that in terms of COVID-19 hygiene practices and the provision of personal protective equipment, specifically face coverings, we found that packing house workers were the most likely to have noticed observable changes and receive additional protective equipment. That direct hire employees directly hired by growers were the second most likely, and that those hired by farm labor contractors were least likely to have noticed COVID-19 changes at work or to be provided with personal protective equipment. So I think that's probably not a surprising finding. There's one thing to note there that will also be reported out in our next data brief, I think, but it's oftentimes difficult especially for those workers who are employed by farm labor contractors, for them to be able to self-report who they're actually employed by. And I'm just flagging that as a subject for further research we need, and to illuminate the sort of landscape of where are agricultural workers, who are they employed by most frequently now, and what is the sort of overlapping system of employment and exchange and movement of workers around the state. It's a very murky field, and workers themselves have a hard time telling you as they move from field to field as part of a farm labor contracting crew on which day they're working for whom. So, so more research on the state of FLCs and direct hire agricultural workers in California is desperately needed.
Great, thank you. And I'm gonna, we're at 5, but I wanna push one more question out just because I think that we can end on a recommendation question. Oh, my screen just moved. Some of the recommendations are very much based on benefits and policies that might be administered by the state. You also identified that workers may be fearful of seeking benefits and resources for multiple reasons. So how do you anticipate being able to overcome these barriers? What are your recommendations about actually getting past those barriers that can then facilitate pursuing the recommendations you've outlined?
Yeah, I think Oralia might have opinions about that, but maybe I could say a few words and we could give the last word to Oralia. But I would just say, you know, quickly on that, there's clearly some trust that needs to be built or rebuilt between communities like farm worker communities and state agencies that haven't served them very well for a long time, if ever. And I would say that there's, in order to provide the kind of supports that are critical to the health and wellness and dignity of the folks that are feeding us, we have to be figuring out ways to connect them to folks on the ground in community-based organizations that are doing this work and have built these networks. And it's not an easy match between those organizations and state agencies, often who want to partner with one statewide nonprofit that they might be able to, you know, send resources through. The communities aren't organized that way, and neither are the community-based organizations. And if we're really talking about reaching them, we need to be building trust between the leaders of those communities, the community-based orgs, and the agencies. And I think that is going to require some big systemic changes to solve. But Oralia, what do you think?
Lo que nosotros estamos
well, what we've been seeing, and as a organization based on community, it's working with our communities to speak more about the rights that we have as human beings and the right that we have to health, and also that the benefits that there is right now, that we shouldn't have fear of using them. And it's also this trust that we have to have and hear them. Our community, something that I also want to mention is, as organizations, we still have to keep working, and we have to make sure that the people in our community, especially the farm workers, have the benefits that they need, and also involve them so that they can keep working and speaking with our representatives so that we can create those policies that have to exist. And that equity, speaking on the benefits and the rights that these farm workers need to have. And this would be an opportunity and a way to see that these services are available and that it's not a weight, it's not a public weight, it's not something that affects us. And this is going to help to create that conversation and that trust in our community, in ourselves, and that they know that they have rights, they have benefits, and that we have to use this that we deserve as human beings.
Thank you, Oralia. I think those are powerful words to go out on, and so we can pause here. And I just want to thank Ildi and Oralia for presenting on the COVID-19 Farmworker Study, and to all of the attendees for coming today. We appreciate it. And this is a monthly seminar, and so we will be here again on the first Monday of the next month, every month through June. And so please register, and we look forward to seeing you then. Take care, everybody. Bye.